Stroke is Singapore's fourth leading cause of death, comprising 6.8% of all deaths and the seventh leading cause of adult disability. It's also on the rise, so what are we going to do about it? Hello, I'm Dr. Leow and I'm a Singlife lifesaver, here to help you find a better way to manage your health. In each episode, I'll answer questions from Singaporeans about health, and today we'll be talking about stroke. Stroke occurs when the blood vessels that carries oxygen to the brain is either blocked by a clot or burst. When that happens, part of the brain cannot get oxygen it needs, so the brain cell die. There are different types of stroke. A stroke caused by a clot is called an ischemic stroke. A stroke caused by a blood vessel rupture is called a hemorrhagic stroke. There is a TIA or transient ischemic attack, which is like a mini stroke caused by a temporary clot. I've searched the internet for your question about stroke, so stay tuned to find out the answer. Click like and subscribe below for more. When a person has a stroke, there are a few symptoms that you have to look at. It is called FAST. First, the face drooping, the arm weakness, the difficulty slur speech, and time to call 995. Time is the essence. Get treatment fast and you can prevent the long-term sequelae of a stroke. So remember, fast. Well, there are a few things you need to do. Number one is to manage your lifestyle. Stroke are caused by some underlying causes like hypertension, diabetes, high cholesterol. So what do you need to do? First, if you do not have this condition, you just need to ensure that you do not have overeating, you sleep well, you manage your stress factor. Now, for the hypertension patient and the diabetic patient, do visit your doctor. They will give you medication to treat, and when you have good control of hypertension and diabetes, your risk of getting a stroke is much lower. Well, unfortunately it does, because diabetes is a condition that also resulting in your arteriosclerosis, the thickening of your blood vessel. And as a result of the thickening of the blood vessel, the blood flow to the respective body, such as your brain, your heart, are much reduced. And the underlying cause of stroke is due to the blood blockage or ischemia. So yes, diabetes do increase your risk of stroke. However, a good controlled diabetic, the risk of stroke is much reduced. The reason for getting stroke is a lot to do with the lifestyle. One, Singapore got fantastic delicious food, so we tend to eat too much. The high cholesterol, the fatty food are actually bad. The second thing is, young people nowadays, they also do not sleep enough. They scroll their internet, they like to do gym at night, so do have to have adequate sleep. Third, exercise. Now, exercise is a good balance to de-stress at the same time to improve your health. 150 minutes per week walk is good. If not, you do something to relax. Last but not least, in this new world, everybody wants to achieve more. Especially when you are young, you think you are bionic. You want to earn your $1 million, you want to do a lot. So henceforth, the high stress work give a lot of pressure to them. They have not enough sleep, they have to make sure that they meet the deadline. So do remember, a high stress job may achieve, but look after your health and manage the stress well. It all depends on which area the blood clot has affected. Although stroke is actually relating to your brain, but in the brain, there are different parts of the place that will affect your function. So those people who have stroke, subsequently, some of them may have memory loss. To the extent of emotionally, they may change their personality a little bit. They're wondering why they are angry and all this. It could be a sequelae of the stroke. Now, if the stroke affects the muscle part of your body, then actually you may have paralysis, or for that matter, some of them actually have speech problem as a long-term effect. The other issue that sometimes happens is that if the stroke affects your control of your urinary system and your bowel, you may even have incontinence. However, all this can be managed, and in some situation, they can have good recovery. So henceforth, do go and see your doctor, as well as the physiotherapy and psychological counseling. You can actually overcome some of this problem. So what should you do if you are concerned about your risk of stroke or anybody else? 1. Getting older is one of the few risk factors of stroke that you cannot change, but most risk factors can be controlled. 2. In fact, 4 out of 5 strokes can be avoided by keeping blood pressure and cholesterol level within healthy range. 3. Smoking increases stroke risk. It is never too late to stop smoking. 4. Get screening for any comorbidity and speak to your doctor about how you can manage them. And finally, make sure you like this video and subscribe to this channel for more life-saving tips from the LifeSavers.